in looking to understand the diagnosis of schizophrenia, we have to understand that it's probably more than one illness. Schizophrenia is really a constellation of signs and symptoms that come together to allow us to form a diagnosis. And so there are multiple groups of symptoms. First of all, the positive symptoms. Positive symptoms are things like sensory experiences in the absence of external stimuli. So people hear voices telling them to run over here or do this or do that. People may see things that other people don't see, or I've had individuals who've said that they felt like people were punching them and they could actually feel it on their body. So hallucinations are one of the important symptoms. In addition, there are delusions, which are false beliefs, beliefs in the absence of external evidence. So people may believe that they're being followed or that they are in the CIA. And those kinds of delusions can be somewhat annoying for family members. Family members will often argue with people. Well, no, nobody's following you. Nobody's trying to hurt you, which isn't very helpful. So the positive symptoms also include disorganization of speech and behavior. So people will not be able to get their ideas across, their sentences and word structure might be confused and mixed up. So you're not really able to follow what they're saying. And then their behavior may be disorganized. They may engage in unusual rituals. They may be afraid to shower, because if they go in the shower, they don't know who will, be there to get them when they get out, and they won't be able to run away because they won't have clothes on. So there are these positive symptoms that are pretty dramatic, and usually are the things that that call attention to someone with schizophrenia and get them into an emergency department or into a hospital. But there are also what we call negative symptoms. And negative symptoms are abnormal because they're things that are absent that people should have. They're either absent or they're very diminished. So people should have motivation, and they should show affect on their face and in their voice when they talk. And they should have social relationships and goals. And what happens with negative symptoms is some of these things are very diminished. So people don't have a lot of physical activity. They may not shower as much. Often negative symptoms are experienced by people where family members will encourage someone, please come out with us, and they won't go out. They don't have friends, and they spend a lot of time idle. So they may do something like get up at 2 PM and smoke a cigarette, and then have something to eat and smoke a cigarette, and they might take a nap and smoke a cigarette. And my husband believes that's the ideal way to spend a day. But if you do that day after day and week after week and year after year, that's what your life becomes. And so negative symptoms can be very difficult to treat. And we really don't have good treatments for them at this point. Schizophrenia is also characterized by cognitive impairments. And this is true for multiple domains. So attention is impaired. The ability to pay attention to something that requires effort. So if you're trying to explain to someone how to take their medicine, it's very difficult for them to listen to a long speech about that. So you have to be very short and very clear. Often people with schizophrenia have difficulty directing their attention. So if you're trying to give them important information and there's a lot of distraction going on around, they're not going to be able to pay attention to you and get the important information they need. Memory is also impaired, memory for faces, memory for verbal information. And so it's sometimes difficult to learn new skills without some kind of extra scaffolding and help. And finally, executive functions are impaired, and that's our ability to plan and carry out goal-directed activity. So you have to be able to get an idea, and then you have to be able to know what comes first and what comes second, and you have to keep going when you're distracted, and all of those things are our executive function. And that seems to be impaired in many individuals with schizophrenia, so their judgment might be impaired as well, and they have difficulty because of these cognitive impairments in functioning. They also have difficulty with what we call social cognition. And social cognition is our ability to make good guesses about what other people are thinking, what are their intentions, what is it they want from me. And people with schizophrenia have a lot of trouble with that. So they can't follow conversations as well and really understand what's expected. And it causes a lot of difficulty in social relationships. So all of the cognitive impairments add up to cause severe role functioning in many people with schizophrenia. Only 20% of individuals with schizophrenia have jobs in the competitive marketplace. Many people have low educational attainment, lower than you would expect by their socioeconomic status. And so the disability associated with schizophrenia is in large part due to these cognitive impairments. There are multiple risk factors that are associated with schizophrenia. When a mother is pregnant during influenza outbreak, when there are birth complications of any kind, there is a higher risk to someone to have the child to develop schizophrenia. There are also genetic reasons. So schizophrenia tends to run in families. You inherit a vulnerability, and that vulnerability becomes a problem when you're exposed to a certain amount or kind of stress that you have difficulty coping with. And that vulnerability then will come out in symptoms of psychosis. Sometimes there's some evidence that individuals who use certain drugs when they're in their developmental years, and they're 13, 14, 15, and they're using marijuana, psychedelic drugs, that they're more likely to convert to psychosis later than people who don't use those drugs. And so it's very difficult to tell. It doesn't happen for everyone, but it can be one of the risk factors. Stress, poverty, abuse, any kind of long-term stress can be a risk factor for people if it interacts with that genetic vulnerability.